Pathmonk is the AI for website conversions. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in the buying journey separates you from the competition online. Pathmonk qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50% by adding Pathmonk to your website in seconds, letting the artificial intelligence do all the work, and increasing conversions by 50% while you keep doing marketing as usual. Check us out on pathmonk.com. All right, everyone, welcome to today's episode of Pathmonk Presents. Let's talk about today's guest. Today, we're joined by Alyssa Labeylie, Director of Marketing at Enter. Alyssa, good to have you on the show.
Thank you so much for having me today.
Of course, of course. So I want to just jump right in, Alyssa, and talk about Enter a little bit and understand from you, the Director of Marketing, about what's the heart of what your company does. How would you describe it to someone new, to our audience?
Yeah, absolutely. So I work for Enter, and we are an AI-first RCM platform. RCM meaning revenue cycle management, and we're based out of San Francisco, but our core team works remotely across the US. And within healthcare, sometimes providers, they cannot collect money because claims are submitted incorrectly to the payers, aka the insurance companies. And there are so many nuances in medical billing, at least in America. It's very,
Mm.
very confusing, complicated, and very easy to make mistakes. Surprisingly, the process is extremely manual, and it shouldn't be. And it causes these denials and headaches, mountains of paperwork. So, in short, with AI, we cut out the likelihood of those errors and denials. And we built this AI platform that helps providers get paid more faster with perfect transparency. And our AI combines advanced machine learning and LLMs with customized automation rules and adapts to your healthcare practice. So every need that you may have, it unifies every aspect of the revenue cycle. So I like to think of us as like the Robin Hoods of healthcare. We just want to help
Mm.
the healthcare providers figure out how to actually collect their insurance money.
Okay, okay, that's that's a good analogy there. You know, the Robin Hood of healthcare.
Yeah.
Um, So do you feel you're able to serve a specific segment, of providers, a specific ICP to keep the lingo, right? Um, and is there a specific, I guess, problem you have them solve besides what you
Mhm.
just described, that it can expect to solve when they come to you?
Yeah, so it's a very, like I mentioned, a very manual, hands-on process when it comes to billing. So after the patient sees the doctor, that's where we step in. And we work with anyone in healthcare who's tired of playing hide and seek with these funds. And it ranges from tiny doctor offices to medical groups, practices, clinics, to massive hospitals. And we help them stop losing money through that revenue leakage. And I like to think of our AI as kind of like this nerdy accountant that we have that never sleeps but actually enjoys paperwork. And so another way to think about it is that we've built this brain that grows and evolves with your practice. So pretend you have like a VP or a RCM manager named Janet. We take that knowledge base of Janet, who understands every workflow within the claim for every team member, for every payer, for every product, and Enter has built an AI version of Janet. So what once took hours across multiple disparate systems now flows seamlessly through one platform, and it evolves and grows with your practice forever.
Got it. Okay. Interesting. Interesting. So, um, this is a two-part question, I guess. So who within the company or the healthcare provider would reach out to you guys, and how would they typically find out about you?
Yeah, so it's a really big range, I would say. It's either the CFO, so the C-suite executives, to an
Right.
RCM manager, to VP of finance, basically anyone who oversees the accounting and financial health of a healthcare practice. And how they find us is essentially through organic search or SEO, LinkedIn, or industry conferences, which I found to be extremely successful. They are my favorite, I think, because we build so much trust through face-to-face interactions. A lot of these frustrations happen, and people want to share like their war stories over coffee. And so we attend a lot of these events across the nation, and we exhibit there as well.
Okay, that makes a lot of sense actually, because human connection at the end of the day is just, it's the first thing, right? And
Mhm.
people crave that, I think, at times. And
Yeah,
so,
especially COVID.
right, exactly, that's exactly what I was thinking. But on the flip side, that's the beauty of the internet these days is just, being able to reach so many people, right? So I'm curious because face to face is one thing, but then online, you said you have a LinkedIn presence, you have a website, right? Um, when it comes to your website, for you as a director of marketing, what kind of role do you think it plays when it comes to attracting new clients for the business?
Yeah, with our website, I like to think of it as the portal leading you to a better future in healthcare RCM. We do our best to showcase our expertise through case studies, targeted content, but we save the secret sauce for the demo, of course. So you have the lead gen form. And we were able to create that entry while qualifying leads through SEO optimized content targeting. So that could be like addressing those RCM pain points and challenges. We have like a strategic demo sign up placement throughout the entire user journey, and we have compelling case studies that demonstrate that ROI. So, in
Hmm.
short, we have like this effective converting strategy where healthcare executives can find us and verify our expertise before committing to that conversation.
Okay. Well, I want to dig a little bit deeper in that, if you don't mind. So,
Yeah.
because obviously, for what we do here at Pathmonk, but also for our audience, they also look on the lookout for, ways to help their conversions, right? So is there anything you learned about what makes a great converting website based on your experience here at Enter, or even from past experience? And specifically, if you have any, let's say, tools, any tips, any methods that you can recommend. You just talked about case studies, strategic placement, right? Is there anything else that you can recommend to our audience to help them convert more?
Yeah. So I've been in marketing for over a decade, and I've been in B2B, B2C, D2C, B2B to C. It's been quite a ride for me, but ultimately for a website, I think the secret to a good one is don't make people guess what you're thinking.
Mm,
It has to be understood by everyone. A really good book I recommend, and I swear by it. He's actually updated it quite a few times. It's called Don't Make Me Think by Stephen Krug. I don't know if you've heard of it, but the
love
more
it.
questions a user asks when they land on your page, that's not a good sign. Those questions should already be answered even before they think of those questions. So it could be something like an image or a graphic or content on a page that just makes them scratch their head. It shouldn't even be there. But through
Mhm.
A/B testing, through making sure that your messaging is clear and concise, fast loading times, and just enough social proof makes your website credible. So present the answers before the questions are even asked. I also think that aesthetics doesn't hurt either. I feel like sometimes people overlook that or they kind of replicate what they've seen from other brands. But as I've been in this career, I've grown to appreciate websites where brands take time to craft their aesthetics in a way that is visually presentable, but also remains grounded in functionality.
Okay. Look, I love that mention of Don't Make Me Think,
Yeah.
because, well, it's really close to my heart because I've got a background in UX design. And so that was one of the first books that, my mentor had me read. And I was like, okay, this makes a lot of sense. And hearing someone like you, in marketing, and some people think, it's all separate, but at the end of the day, I think we're actually much closer with, design and marketing and sales even. Um, that's a really good recommendation. So
Yeah, I swear
Thanks for
by that
that.
book, like my
Yeah.
Bible.
Yeah, that's awesome.
Yeah.
All right, so I want to switch gears for a second and talk about you as a leader, Alyssa. On a typical day, what are the main things you focus on? Because I know marketing directors and people in marketing in general, they wear so many different hats. They don't even know what they do. But if you could give us a glimpse into your day in a life, that would be great.
Yeah, so I split my time between a number of tasks, as you mentioned. One of it's focusing on AI-focused content that speaks to our healthcare leaders. Um, and because our platform is a little more complex and niche, I'm constantly working with our dev and product teams to translate any of that complex tech lingo into simple stories. And I'm a firm believer of collaborating with everyone in the company, whether it's the graphic design department, the dev team, the product team, sales team. It's just not just checking in, but also to get a pulse on what they have experienced from their point of view with our clients, as well as our prospective and current clients. And aside from that, I also lead our conference strategy as well.
Okay. So again, a lot of face-to-face time, actually being in touch with customers, l- actually listening to them, right? And
Mhm.
so that's very good because I think it's good practice, obviously, but many companies are actually when they miss that, they don't get as many good findings or insights or um, as they can. So it's good to hear. So we are before we wrap things up, we're coming towards the later stages of the interview here, towards the end. So I would love us to jump into our rapid fire question segment, if you don't mind. And
Yeah.
the only rule, let's call it rule that we have is that we're only looking for short and crisp answers. Are you ready?
Okay. Okay.
All right, cool. So what's the last book you read?
The last book I read was the Genki Elementary Japanese Textbook, third edition.
Amazing. What the no, that's good because it's true, right? You
Yeah.
think about the last one. So, out of curiosity, was that for you? Was that for
So I made it my life goal to learn as many languages as possible. I
beautiful?
am on my fourth language, so I've mastered three so far. I give myself about 5 years to become proficient enough. And I encourage all the listeners, if you speak another language, I highly recommend going to the country where that language is the primary language and market. So I've lived and worked in France and Vietnam, and I've marketed in both. It's been quite a ride. I learned about the nuances and how you market and craft your language in a way that's compelling to an audience. But what I've come to realize is like with every country, they all share a commonality when it comes to marketing, but you learn about business culture, you learn about how to present yourself in a way that makes sense to everyone. So I've had a lot of fun doing it. I highly recommend anyone who loves to travel but also wants to learn another language to definitely do this.
Agreed. I'm bilingual myself, and it's definitely changed my way of thinking. Also, I would say so.
Yes,
That's
exactly.
that's great advice. Okay, so that's on me for going off the rails, but that was really interesting. So, what's the one single thing that your company is focused on at the moment the most?
We are focusing on presenting ourselves as the AI leaders in RCM. Our audience is rather spread out, so yeah, I want us to be the thought leaders as well as being that beacon for these providers to relieve all the stress of paperwork, mountains of paperwork, and to help them reduce that revenue leakage.
Okay, that's good. Um, Maybe this one is connected, maybe it's not, but if there were no boundaries in technology, what's one thing that you would want fixed for your role today?
Oh my gosh. So in RCM, my audience, doesn't have like a set persona or demographic. It can be like someone who's like super tech savvy to someone who prefers that face-to-face interaction, someone who's more traditional in like a business etiquette sense. So if there's a way to automate where they all gather, like what kind of digital watering hole that would be ideal. But,
Mm.
as marketers, we have to adapt. We have to try every single platform, every single channel. But maybe in the near future, there might be like that one single source where they all gather.
Yeah, that source of truth. Like, yeah, the
Hmm.
source of it makes me think we all need some kind of centralized information type of a tool maybe even that gives you that, right? But I don't think it's out there yet, or maybe not perfected, right? So
Someone's made
that's
it. Please get in touch with me.
right. Okay, so what's one piece of advice that you would give yourself if you could restart your journey as a marketer today?
Mm, it would probably be niche down faster if you're in marketing. There are so many branches in marketing, SEO, content, social. Like my beginning years of marketing, I spent so many years learning every instrument of the orchestra when I could just master the triangle and then move on to another instrument. So
Mm,
once you've mastered something and you feel confident, branch out. But doing everything, I know there's lots of like one person marketing teams in companies, but try to master one thing because I'm noticing more and more as time goes by that people are looking for more niche marketers.
okay, that's a good one. Makes me think about, have you ever heard about the T-shape professional?
Hmm.
Um, right. So, you have that the broader knowledge, which is great to have because you can do different things, but then you have one thing you specialize in, right?
Yes,
So that sounds to me like that would be the approach to take if you could restart, or for any uh marketer starting today, or just learning the ropes. That would be a good piece of advice for sure.
precisely.
um Good. Well, Alyssa, I want to thank you for being on the show with us today, and I also want to give you the last word. So if someone forgets everything about the interview today, what's one thing that they should remember about the work you guys are doing at Enter?
We are trying to fix healthcare and we're doing everything we can through AI-first RCM. So automate and also introduce a solution to providers who are drowning in financial stress and burden.
Okay, beautiful.
Mhm.
So if you're in the healthcare industry, then go to enter.health
Mhm.
and you can check out what Alyssa has been talking about, see if it's for you.
Thank you so
All right,
much.
of course. Well, good to have you in the show again, and hope to see you again soon.
Thank you.
Thank you. Bye bye.